Okay, so we're going to talk about influenza next, and it actually has a lot of symptoms outside the respiratory tract, but it is a respiratory virus. So influenza is a specific type of virus. Lots of people will say, oh, I've got the stomach flu. That's not really a thing. Influenza can have effects on the GI tract. But when people say they have the stomach flu, usually they're referring to some sort of viral, some other viral GI illness. So people may also think that they got a cold that turned into the flu. They're different viruses. Okay, so influenza, it refers to a specific type of virus. They're transmitted by contact and droplet. They're most contagious 24 hours before and after symptoms begin. So what happens is the influenza virus destroys the epithelial cells of the respiratory tract that have cilia. So it destroys those epithelial cells. Inflammation begins in the upper respiratory tract and then it descends. That inflammation, because of the destroyed epithelial cells, can lead to atelectasis. Remember, that's when the alveoli don't stay inflated, pneumonia, and secondary infections. The signs and symptoms may range from mild to severe. Now, flu usually is a sudden onset. It's on a gradual prodrome. It usually is a sudden onset. People say they feel like they got hit by a truck. They have fever and chills, dry throat and nose, a dry cough. They're hoarse. They may be flushed. They may have photophobia. The light hurts their eyes, muscle aches, fatigue, and exhaustion. Okay. Now, there are some complications. They can actually develop a severe viral pneumonia. So the virus itself can cause inflammation in the alveoli, in the lung tissue. They can develop encephalitis because of the virus, or they can develop secondary bacterial infections because of the inflammation in their airways. Medical management. Flu can be a severe illness. It is self-limited because it will go away on its own if the host survives. So we give supportive care. We want to treat fever, hydration, humidify, and monitor for those complications. There are antiviral medications that can lessen the severity. They have to be administered early in the course of the illness to have any effect. And so the timing of administration is pretty important. There are a lot of people who complain about side effects. And so people who aren't at increased risk may choose not to take those antivirals. Nursing care, we want to promote prevention. So that means we want to encourage vaccination. Anyone who's been diagnosed with the flu should be taught to stay home until they are 24 hours fever-free without meds. And they should stay home usually a minimum of 5 days, whichever one of those is longer. And that patient would be on droplet and contact precautions. Promote comfort. We want to humidify and hydrate. Antipyretics, manage fever. Remember that kids should not get aspirin with viral illnesses. It's associated with Reye's syndrome. And then we want to monitor for complications. Is their respiratory status getting worse, or are they unable to stay hydrated? And lots of teaching about home management. All right, the next section is going to be about ear infections.